Yes, now this is the last session, and we began from Hahnemann and we are ending with Hahnemann, that is chronic disease, and we shall talk about syphilis and psychosis, what Hahnemann has described. Now, psychosis is named Figwart disease, and syphilis venereal chancre disease. It is unfortunate that we understand psychosis means gonorrhea, whereas Hahnemann did not say like that. We should see psychosis, fewest chronic disease, was considered homogeneous with venereal chancre disease before Hahnemann, and here it is described under, I have brought it under two heads. One is excrescences, that is the extra growths in psychosis, and second is use of THUJA in psychosis. This is what is to be understood. Now, under excrescences, they first manifest on genitals, usually, but not always attended with gonorrhea. That is, it is not necessary that gonorrhea will be present. But what will be present in psychosis is excrescence. Discharge is thick like pus of psychotic gonorrhea. Micturition less and difficult, and body of penis is swollen and hard. Balanitis. Then common gonorrheas is differentiated. In common gonorrheas, they do not penetrate whole organism, only stimulate the urinary organs. They yield to simple drop dose of petroselinum, fresh parsley juice, or when indicated by frequent urgency to urinate, a small dose of drop dose of petroselinum when indicated by frequent urgency to urinate. Simple symptom. Or other remedies are small dose of cannabis, cantheris or copiol. Three remedies is described according to their constitution and other ailments attending. Always use higher potencies here, not mother tinctures. This is what has been advised. So these are common indications. Then when latent SORA develops by allopathic treatment, if gonorrhea is treated by other medicines and latent SORA develops, then secondary gonorrheas, they come to stay. They don't go away. And unless and until cured by antisoric treatment. So there is a non-psychotic gonorrhea. This is what Kent has described as non-psychotic gonorrhea that has been taken from here. Then penis is covered on back. We are talking of excrescences. Penis is covered on back with glandular tubercles, painful to touch. Days or weeks after infection through position, of course. Then rarely appear dry like warts also, like warts. Frequently soft, spongy, emitting bad smelling fluid, sweetish like herring brine. Sweetish is one thing and herring brine is fishy. Then bleeding easily like cockscomb or cauliflower. So cauliflower like growth, cockscomb like growth is the description given to these excrescences or warts that has been described. Then males, the picture is sprout on glands and on or below prepuce, and in females it is on or around the pudenda, swollen, covered by many of these excrescences. So this is the excrescence in psychosis. Then when violently removed, if these excrescences are violently removed, they come forth again. Even if rooted out in this way, that is, even if they are removed, they have consequence. That is, it converts into a chronic disease, and that is the Figwart disease. That is psychosis. After deprivation of local symptom, destruction of local symptom, which is vicarious for internal ailment. That is, vicarious means substitute. So when that substitute is disappearing, Then secondary ailments appear for Figwart miasm. Excrescences afterwards will break out in other parts, and that is, these three are basic features of spread up psychosis. Whitish, spongy, sensitive, flat elevations in cavity of mouth, on tongue, on palate, which can be soft palate back and hard palate front, and lips, or large raised brown dry tubercles in axillae, on neck, scalp, or other ailments like contraction of flexor tendons of fingers, the flexor tendons and extensor tendons. So if the flexor tendons are contracted, the hands will become like this. So that is yes, and that is diseases associated with this, picture associated with this. Then under this, after excrescences, we go to use of THUJA in psychosis. Gonorrhea is dependent on Figwart miasm. Gonorrhea is dependent on Figwart miasm, whereas Figwart miasm is not dependent on gonorrhea, as well as excrescences. So here, any gonorrhea which is dependent on Figwart miasm as well as excrescences, that is whole psychosis, both gonorrhea as well as the Figwart miasm, they are cured by THUJA. Decillion word is written for third lesson. When action is finished, after 15, 20, 30, 40 days, that means you give THUJA and wait for these many days. Its action is sufficient, yes, single dose. Single dose. After 15, 20, 30, 40 days, alternate with a dose of nitric acid, again in decillion, allowed to act for same time. To remove gonorrhea and excrescences whole psychosis, no external application except in difficult cases. Normally no external is required, and when there is large Figwart, then moisten it every day with mild pure juice formed from green leaves of THUJA mother tincture mixed with equal quantity of alcohol. Now remember, this is what is written by Hahnemann in chronic disease, and that chronic disease aspect was not ultimately edited, but he wrote subsequently 6th edition of Organon, where the 50 millisiemens potency has been advised, and over there the full doses of 50 millisiemens potency are to be given in primary conditions of syphilis psychosis and PSORA. That means instead of diluting finally, you have to take the mouthful doses and repeated doses in gonorrhea primary state also. So potency, you have to link that with this. This is primary disease. हाँ, वापर सकते हैं, वही मैंने आपको कहा. That's what I am telling you. I'll put the question in the end. But then this is added. First description में you have to understand this. Then the 50 millisiemens is afterwards addition. So you have to add that. We use it and we find results. Coxcomb means शहद का छत्ता. Then syphilis. Syphilis is described under chancre. Then 3 states of syphilis. Results of local suppression: first state, second state, third state. PSORA awaken after maltreatment of syphilis. Pseudo or spurious syphilis. Treat till manifest venereal symptoms pass away. Then sign of complete extinction of venereal disease. Case of Master Tyler. So syphilis we will be covering under these many heads. Let us take them one by one. Chancre. After an impure position between 7th and 14th day on the member, that is male female, infected with miasm, a little pustule changes to ulcer, raised borders, stinging pains. If not cured, remains on same place for lifetime. In form may be varying, but it does not go away. Increasing with years, patient doesn't allow it to remain like that. He suppresses it, no? Then secondary symptoms of syphilis don't break till it exists. But once it is removed, then the secondary symptoms begin. Rarely complicated with psychosis, that is syphilis and psychosis, both of them combining with each other is a rare thing. But syphilis commonly complicates with SORA. So there is soric and syphilitic combination. Then there are 3 stages of syphilis in cure of venereal disease. When you want to cure venereal disease, there are 3 stages. One stage for that purpose is when syphilis alone with chancre. Only chancre, no other thing. Or if removed by external applications but associated with other local symptom, which is bubo. Bubo is lymphadenitis. So bubo is associated. Then rarely impure coition is followed by bubo without chancre. Sometimes it happens without chancre, only bubo comes. Chancre is very mild or does not appear, but bubo is there. But usually bubo comes after destruction of chancre by local application. It is a very troublesome substitute because of painful, inconvenient symptom. And when it is alone, without second or third miasm, that is without psychosis or SORA, but deprived of local symptom, chancre and bubo. Syphilis is alone, but chancre has been removed or bubo has been removed. Both have been suppressed. And when complicated with other chronic disease, SORA is already developed. That means syphilis is not complicated with undeveloped SORA or latent SORA. Latent SORA and syphilis combination is not found, which you read in many books subsequently. But no, he says SORA which is already developed and local symptoms may be present or removed by local application. So that is the 3 states is the first state described here. First state, second state and third state. First when syphilis is alone with chancre. Second, it is alone but complicated without second or third miasm but with only removal of local symptom. And third is when it is complicated with other miasm. First stage, second stage and third stage. I will again repeat, first stage when only syphilis alone. Second stage when the local symptom has been removed. Here local symptom has not been removed. No miasm, second, third has been added. And finally, when it is complicated with either psychosis or syphilis or both. Then, results of local suppression. Allopathic physicians destroy chancre by cauterizing substances, wrongly conceiving it as a local ulcer or sore from without. But it is wrong to think that when it appears, no internal venereal disease exists. That means if they think that if local symptom goes away, then the disease goes away. That is a wrong concept. When chancre is removed, venereal disease goes is a wrong concept. If ulcer remains long in its place, absorbent vessels transfer poison into internal organism is a wrong concept. That is for that fear they are removing. Venereal infection of whole body begins the very moment impure coition takes place. The very moment. And this has been supported finally by microbiologists. That when does the infection take place? At the very moment infection takes place. It is a different thing. Manifestations come afterwards. Then suppressed chancre. If the chancre is suppressed, then there can be painful substitute bubo, which hastens for suppuration to suppuration first formation, and suppression of bubo. What it causes? Troublesome secondary symptoms, the secondary syphilis, then through outbreak of whole chronic syphilis, slowly but certainly, not before several months elapse. So that is the secondary stage. That picture of syphilis is found in medical textbooks also. Primary syphilis, secondary syphilis and tertiary syphilis. Easiest to cure with local symptom. Cure of venereal disease is easy and convincing when chancre is still present or bubo is still present. In this state, especially when not complicated with SORA And on earth, Hahnemann says no chronic miasm or chronic disease springing from it is more curable and more easily curable, provided it is present in its primary state. But if it is suppressed, if it goes into secondary state, then it is not as easy to cure. Then first state, second state and third state. In first state, here what is there? One little dose of best mercurial remedy is sufficient, merc salt, to cure thoroughly and forever whole syphilis with its chancre within 14 days. Now remember, if the duration is reduced to half or one third, then this by 50 millisiemen will be reduced. Is reduced. Few days after a dose of mercury, chancre without external application becomes clean sore with little mild pus and it heals of itself, proving that venereal disease is extinguished. That is the best proof. And not the least scar or spot is left behind in the first state when it is present with its local symptom. Second state is without complication with SORA, secondary venereal disease is avoided. Man is freed from venereal miasm through simple internal cure, here also by a dose of mercury. Certainty of cure is proved if chancre during cure becomes a mild ulcer through venereal, through internal remedy, and manifestly venereal disease is cured of itself. So that is the sign that the disease is cured when it becomes into a mild ulcer and finally goes away. Then sign of cure to visible careful observer. Sign of a non-completed and completed cure. Now there is a test, pathological test, but then here Hahnemann tells the symptomatic test only manifests to an exact, that is careful observer. If you are observant, if you are careful, you will be able to note it. What is that? When chancre is driven out locally, even if remedies are not very accurate, not very strong, local signs of unfinished internal syphilis is present in discolored reddish red or blue scar. That chancre, even after external application, leaves some discoloration and scar, reddish, discolored. And when cure is effected by internal remedy, then spot of chancre is no more recognized. It disappears. Skin is as smooth and of same color as the rest. So that is the difference between the two. Then presence of discolored scar is a sign of unfinished internal syphilis, and person otherwise in good health and not yet complicated with SORA, no SORA is there, to free from every reminder of venereal miasm, one dose of mercury as above said cures it in completed, cure is completed, scar again assumes healthy color and all discoloration disappears. Color is returned to normal, discoloration is disappears and scar goes away. Then after local expulsion of chancre, if chancre is expelled locally, bubo breaks out, but no other chronic disease. The internal syphilis is not complicated with a developed SORA, if that is the condition, then it happens rarely. Normally it is associated. Some treatment, same treatment while bubo develops. If bubo is developing, then same treatment as merc salt. Then completion of cure is recognized by same sign, that bubo disappears and no outbreak of venereal disease is apprehended. So this is a test that bubo should not be there and this spot should disappear. That is what is the sign of visible cure to a careful observer. Now let us go to third state. Syphilis is complicated with SORA. There is a patient is there in whom there is syphilis and there is already a developed SORA. When at time of syphilitic infection, developed chronic disease already exists. Till chancre exists, no chronic disease occurs at outbreak of chancre, even if SORA is in latent form. If SORA is in latent form, not developed form, then it will not combine. Because latent SORA can not combine with any other developed disease, maybe sycosis or maybe syphilis. Then if local symptom is destroyed externally, if the chancre symptom is destroyed externally by injurious allopathic medical treatment, then general health is deteriorated. Latent SORA becomes developed into chronic ailments. That very latent SORA, which was there in a hidden form by drugging, by medication, injurious medication, it develops into SORA, secondary SORA, and that combines with intransigence. So there is a condition which is a combo condition, where there is syphilis as well as SORA. SORA only complicates with venereal disease when developed as manifest chronic disease, not when latent and slumbering. Same point repeated. That was the methodology of Hahnemann's writing. Points were repeated again and again, so that you can understand and you can remember. So you will, while reading chronic disease, think that there is a lot of repetition, but that repetition is to drive the point home. I could have omitted this and told in short also, but then it would have lost the original pattern of what Hahnemann has been telling us. Then therefore, when complicated with developed SORA, impossible to cure venereal disease alone. While in latent stage, cure of syphilis is not obstructed, but in developed state, you have to treat SORA also. So that is the third state. Now, SORA awakened after maltreatment of syphilis, that is covered as a separate point. When you will read chronic diseases, theoretical part, it is a running description. No such headings are there. These headings have been made by us to make the point better understood. You can read it again and you will appreciate this. SORA awakened after maltreatment of syphilis. After local destruction of chancre, what happens? Often syphilis is left uncured. Then gets complicated with awakened SORA, which is seldom in young people, though SORA undeveloped before venereal infection. Earlier it was in latent state, but by treatment it becomes developed. SORA awakens by violent treatment of venereal disease, large doses of calomel, corrosive sublimate, different combinations of mercury as mercurial remedies cause symptoms like fever, then dysentery, abdominal ailments, chronic exhausting, salivation, pain in limbs, sleeplessness, etc. Nowadays also different druggings are there, including steroids, etc., including many other substances where patients have these symptoms, but that is a different chapter. Here these symptoms are present. Now SORA is as a result awakened. SORA becomes in its full secondary form. So here there is a condition which is described as pseudo or spurious syphilis, false syphilis. Combination called masked spurious syphilis is a dreadful combination of SORA with syphilis. SORA remains incurable if syphilis is not destroyed. In England, pseudo syphilis is monster of a double disease. If there are two heads, it is a monster. So that is why it is called monstrous condition. Large and frequent doses are added. Third dimension becomes added, a medicinal disease, and in addition to double disease, this medicinal disease is having debility, weakness in patient. Patient becomes in a most sad state. Hypersulf is preferred to sulfur. Here, important point for us to understand is, in such conditions, hypersulf acts better than sulfur. And what is the management described by him? After removing all outside harmful influences, keep on light, nourishing and strengthening diet. Then give antisoric medicines best fitting to prevailing state of disease. Wait till medicine completes its action. Also give a second most suitable antisoric, not a single remedy. The single remedy, what we have been shouting is giving at that particular time. But after its action is complete, it is going to be a series of remedies which is not to be thought of from early plan, depending on the picture of the patient. Then give best mercurial preparation afterwards to act for 3, 5 or 7 weeks. Again I repeat, By 50 millisiemens, this duration will be reduced to half or 1/3 till improvement of venereal symptoms occurs. That is pseudo or spurious syphilis, where there is either syphilis alone or not alone, it is in combination with PSORA, either 2 or double complex, that is third. Treat till all manifest symptoms pass away and color returns. That very particular aspect is repeated here. In deep-seated difficult cases, first course hardly sufficient. Still some ailments and disorders remain, neither purely psoric nor definitely syphilitic, requiring additional help. And repeat similar process of cure, giving one or more antisoric remedies which have not been used, which are homeopathically most appropriate, until whatever psoric symptoms are left, that disappears. Then mercurial remedy in another potency given again, allowed to complete its action till all manifest venereal symptoms entirely pass away, such as, which are venereal symptoms? Pricking, painful ulcer of tonsils. Then round copper colored spots. Copper color is very important. Shining or shining through epidermis. That is, it is not apparently outside, but it is just shining behind the epidermis. Eruptive pimples which do not itch. Pimples which do not itch. Itching differentiates PSORA from syphilis. Then chiefly on face, on a bluish red foundation, painless cutaneous ulcers on scalp as well as penis, smooth, pale, clean, covered with mucus, almost level with healthy skin, etc. And then this is all skin. And then boring nightly pains in exostosis, that is in the extra growths of the bones. So that is the methodology is described how to go ahead. Then sign of complete extinction of venereal disease. Secondary venereal symptoms are changeable. They come, they go, they are different. Their disappearance is no certainty. Even if they go away, no surety whether they will come again or not. So on the basis of that, you cannot say whether the patient has been cured. What is the consideration? Conclusive sign of complete extinction of venereal miasm is return of healthy color and disappearance of discoloration in scar after destruction of chancre by local application. The scar which was left, that should disappear. So remember, this is possible only when that particular patient comes in that stage to you. Finally, a case of a master tiler. Dissolute wife, faithless wife, infected him with a venereal disease, which was whether a chancre or a Figwart could not be understood. Picture was mixed. So maltreated by violent mercurial remedies, because the picture, it was already suppressed when the patient came. He had lost his uvula. Uvula was destroyed. His nose was affected. Fleshy parts were eaten away. Remaining part was swollen and inflamed, pierced like a honeycomb with ulcers, coxcomb, with a great pain and intolerable bad smell. Had a psoric ulcer on leg. Antisorics improved ulcer to certain degree, healed ulcer on leg, then took away burning pain and most of the bad smell of nose. Remedies for sycosis caused some improvement, but nothing further was effected till he received a small dose of peroxide of mercury. And everything healed and restored to full health excepting the inseparable loss of nose. So this loss of nose could not be reported. So this is few of the rare cases which Hahnemann has described. So that is what is about psychosis and syphilis.
Syphilis, chancre,